afternoon and welcome to episode 2 of A Look Behind the Job Posting. I am your host, Paul Moss, and I am one of the recruitment, marketing, and sourcing coordinators here at UNC Health. In these episodes, we're going to pull back the curtain and provide you with an in-depth look at some of UNC Health's departments and open positions. We have another very exciting show lined up for you today, as we will be joined by a program manager and a senior business intelligence analyst from the UNC Health analytics team, along with a recruiter for that division. If you have any questions or feedback during the show, please throw your comments into the chat and we'll get them answered for you. Our first guest is a program manager for the Revenue Cycle Analytics team. Please welcome David Janorio Swanson. How did you get into analytics?
I started out working for a very small consulting firm. I was able to build a career in analytics, and through consulting, I provided analytical services, and then I worked for Aviana Healthcare, and then I came over to UNC as just an analyst, and I've been able to grow here to a point where I've been promoted as a program manager of Revenue Cycle Analytics.
The word analytics can be a very vast term. Can you tell us what UNC Health analytics means to you?
I've always looked at analytics as storytelling. I love to tell a story, and any analysts who I talk to love to be able to tell a story, and that's ultimately what we're trying to do here, I think, across UNC Health Analytics.
People with your skill set can work in most industries. What do you like about healthcare in particular?
But with healthcare, we don't have customers, we have patients. And that's such the awesome part about working in healthcare, is that we are trying to support our patients, especially here at UNC. I had a decision to make with multiple job offers on the table, and I chose UNC specifically because I knew that they had a strong purpose and effort back to the patient, and that every dollar that I went to go collect went back to research, went back to customer service, went back to the patient. It just brings such fulfillment versus any of the other analytical work that I've done.
Can you tell us about the framework of analytics as it expands across the system?
I work in Rev Cycle Analytics. We have an information science division that works with enterprise analytics that focuses on both the architecture and the infrastructure involved with our tables and anything related on how we try to build something out into our reporting. And then we have an enterprise analytics division, which helps with taking all of our operational teams, and when there's an issue that might span across operational groups, for example, COVID, that impacted all of us everywhere, and they took a lot of the lead when it came to that. And then you have my department, which is in a lot of different departments across UNC, which are department specific. We focus on revenue cycle, and I become the data steward of that. I become the expert of that, so I can be able to help the other analytics communities answer questions associated with that. And I can help our operational leaders be able to get the support that they need.
I noticed your team has received a lot of awards and accolades. Can you tell us about some of the recent ones?
One of the ones that I'm really excited about is that we work with North Carolina HIMSS, Health and Information Management Systems, and they have stages of analytical success. And we have reached stage 7, and across the entire country, only 2 entities have reached stage 7, and we are the only entity to receive certification, which means that our data governance is one of the strongest in the country. Our Epic upgrades are some of the top in the country. Our ability to report out on all the different areas that span across our great system are some of the top in the country. We received the Informatica Innovation Award, which is for our COVID-19 response, which was focused on our data governance.
Do you have any big projects currently in the works that you would like to share?
We are currently working on point of service collection. So when you go to to your clinic, to the hospital, to the emergency room, you meet with a registration person, and that registration person gets your name, all your information. You fill out that stuff on the clipboard, and then you ultimately have to to pay a copay, or you pay a deductible or something of the sort up front. We're trying to make that process seamlessly by working with estimates teams to be able to contact you beforehand to let you know how much something is going to cost before you even walk through the door for major surgeries or other events. And our team is really focused on determining what is the accuracy of those estimates and how are we ultimately doing. Are we going out and are we interacting with our patients and educating them and being able to get the collections that we need to keep our business running?
How has your team's work provided better patient care?
We have a team that is patient financial services and patient access, and pre-arrival services, who are working and trying to work with the patient to make sure that their time from prior to the date of service to when they are discharged is seamless from a financial perspective. And that when they leave and 30 days later they might get a statement from us, they're not surprised.
What does a typical day for a program manager in your department look like?
Our team uses an agile type approach. We develop sprints, and develop tasks within those sprints to accomplish. And then we also work with my support tickets. The best part of my job is I have an awesome team. My day-to-day operations is really looking at those tasks that need to be accomplished over the next few weeks and trying to remove roadblocks so my analysts can be able to get them. And sometimes I'm a player coach. Sometimes I like to go in and get my hands a little bit dirty, and I maintain a few dashboards just because I have that background to be able to do that.
When you think of a star candidate, can you provide us with some skills or experience needed that is not listed in the job description?
You'll be successful if you do two things. One, can you tell a story? You want to be meticulous and get into the details, but the goal is to ultimately be able to tell a story. And then two, I enjoy someone that likes getting lost in the woods. We have solved the really easy problems. The easy problems have been solved. We are now on to the really hard problems. And sometimes people come up to me and go, "Hey, Dave, how do I solve this?" And I go, "I have no idea, but I'm going to be able to help you. I'm going to be the lockstep with you as we try to figure this out."
David, thank you so much for your time. It's been a pleasure. Our next guest is a senior business intelligence analyst from the Analytics and Performance Improvement Collaborative team. Please welcome Becky Van Valkenburg. What made you decide to get into the analytics profession?
Well, I love puzzles, and you'll find out that a lot of your analysts really love puzzles. And analytics is a big puzzle. So I love to be able to figure things out. You take a request and you just try to determine first, does that information really exist? Second, is it retrievable? Third, can you link the information together? And fourth, can you really create something meaningful? And it's such a good feeling when you can create something that makes someone else's life a little bit easier and also can lead to the improvement of a patient's health.
Can you please provide us with an example of your typical day?
My day really depends on the priorities for the day. I'm involved in a lot of different areas, and I'm also considered a team lead, and some days may be dedicated to working with my different team members. We have several that have been here for a year or less, but regardless, I work very closely with every analyst, whether they're old or they're new. I really work with mentoring, training, assisting with assignments. And a lot of times when we meet together, we're either like reviewing their assignment status and their needs or reviewing their code. We do code reviews, reviewing their logic. We're reviewing, any issues that they're having, debugging results, assisting in validation, which is something that we really stress where we are to put out some really good product. The other thing, it could be an ad hoc request. We get a lot of requests through our request system, and I actually help prioritize, assign it, and I take some on myself. So sometimes I'm working with that. We work with our external people such as ISD or other departments. I consult with a lot of them, or it could be working on this major new redesign project that I'm on.
How are you challenged in your role each day?
There's a lot of challenges. Every day is a challenge, but I'm going to focus on really three areas that are really the biggest challenges. One of them is the changing technology, because as technology changes, there's always new things to learn. And we can, as we learn these new things, we may need to go back and review and rewrite some of our code and to incorporate the new technology or new knowledge gained in doing that. The second one is an increased demands. So we're seeing a lot more reliance on and a greater need for more flexible visualization or data every day. So we're really seeing demand increase. So that can produce a challenge for us. The other one is user interaction. And this is really key to any data analyst. So data interpretation is key. You're learning about the data from news sources can be quite challenging. You have to rely on your co-analysts, your ISD teammates, your subject matter experts, and the user that is requesting the need. Interpreting these needs of the users can be very challenging. Some of the requests are really vague. They're not very clear. And some of the requesters are really not sure how to ask for what they need. That's where we as analysts can really help drive that conversation. But we have to learn their world at a very high level to provide good data and good results. It's really part of your data gathering, your requirements gathering.
How would you describe the working relationships amongst your team?
Oh, we have a great team, great collaborative team. I can't say enough good things about how well we work together, whether it's with our own department or with ISD or with our user community. We really strive to build a good relationship with our requesters and other departments. We coordinate with our using or requesting departments the build, the testing, and the validation. In other words, they are included in every step of the development. In interviews, I'll sometimes ask how the applicant can be successful. I usually tell them to share their knowledge with us. And we're committed to sharing our knowledge with them as well, because we are really, truly one great team. We encourage and we promote sharing of the knowledge and helping each other grow our technical skills, presentation skills, and other personal development. We really and truly support one another. And this starts with management. They are always willing to listen, provide feedback and direction. And there's such an open door policy in our department that you're free to ask whatever you need. And there's transparency.
The work that you do can sometimes literally help doctors and nurses save lives. How does that make you feel?
I like to say that we impact patient care through quantitative measures. Our focus in PQI is really toward the clinical and patient directives. So, I have a lot of pride in what we do and being part of such a great organization. It gives me a great deal of self-fulfillment for helping others, because the information we provide really does lead back to patient care. And I feel really good about being part of something so much bigger and so good.
To someone in data analytics who is on the outside looking in, what might you say to them if they're considering the jump to UNC Health?
I say go for it. Healthcare is a really good place to be right now. And UNC Health is a great organization. I've been here for almost 25 years, and I'm so glad that I joined.
Becky, we really appreciate the insight. Our final guest joins us from the talent acquisition team. Please welcome lead senior recruiter, Carla Flanagan. Can you please tell us about the interview process and the timeline?
After the recruiter screens the applicants, the hiring manager will receive the application and schedule an interview with the candidate. Some may schedule a phone screening, then an interview. That all depends on the manager. After the interview, the hiring manager will determine if they want to make an offer or not. Once they select the candidate to offer, the recruiter sends references. We call the candidate, make the offer, and then we notify the manager if the candidate decides to accept or decline the offer. If the candidate accepts, we determine the start date with them and we go over the onboarding process. From start to finish, you could see maybe weeks for a manager to interview and offer. It all depends on the department.
What types of interview questions should our candidates expect?
In interviews, candidates may be asked some technical skills, problem-solving questions, and they may be asked to tell the manager a little bit about their past experiences. Managers may ask about previous job projects and ask to share measurable outcomes. For example, if you worked on a process improvement project, did you save money? Did you improve the patient experience? Did you automate a process? Did you save time?
Is there something in particular on an analytic candidate's resume that you would like to see?
Managers look for keywords that demonstrate a candidate's knowledge, skills, and experience as it pertains to a particular role. Experience can come from education, including school projects, internships, or job projects. For example, if you're applying for a job as a business intelligence or data analyst, one of the skills listed on the job description is Tableau. On your resume, you want to reflect that you have experience in Tableau or a similar software as Tableau. Also, one of our analytics managers wanted me to point out, if you're reading through an analytics job description and you don't have all the skills listed, don't let that prevent you from applying. Some of our best analysts have transitioned from either a clinical setting or from outside of healthcare and may have been able to fill any gaps through on-the-job learning and training.
Carla, thank you for joining us. That concludes our second episode. A big thank you to all of today's guests, David, Becky, and Carla, for providing us with a look behind the job posting. Please join us next month when we are joined by the nursing staff at Chatham Hospital. Until then, remember to see yourself at UNC Health.